Hello everyone, I'm Dr. Shikha Aggarwal, Dermatologist at Bliss Laser Skin Clinic, Ludhiana. Today I'll be discussing about Polycystic Ovarian Disease. Now what is Polycystic Ovarian Disease or PCOS? Many times these terms are used interchangeably, but PCOS is a severe form of PCOD, or PCOS is an endocrine system disorder in which there are small tiny cysts which are formed in the ovary, while PCOD is a condition developed from an imbalance of reproductive hormones in the females. Now, what causes PCOS? The exact cause of PCOS is unknown, but lifestyle definitely plays an important role. And secondly, hereditary factors, like if your mother has a PCOS, you can also have a PCOS. High androgen levels, which is also called as hyperandrogenism, or the increase in the male hormone, which leads to the insulin resistance, can also be responsible for PCOS. Now coming on to the symptoms of PCOS. What are the important symptoms you will get if you have PCOS? As the name indicates, PCOS is a syndrome. It will consist of combination of many symptoms that affect the female health adversely. This condition affects ovulation, and the major symptom in the women is irregular periods or infertility. Like if the lady is married or if the girl is married, then she may notice that she is not able to conceive, and she may have heavy bleeding or very scanty periods as per accordingly. This is the main gynecological feature. The other common symptom that we have observed in women with the PCOS are acne. This acne, it occurs in the adult onset pattern. That is on the lower jawline and the chin area, and it is also found on the upper back. 80% of the females also encounter rapid gain in weight. This rapid gain in weight is mainly in the lower abdominal region. The waist to the hip ratio that is altered in these patients. Growth of hair on unusual body parts such as the face is very common, and the quality of the hair is very coarse, and which is called hirsutism. It also causes uneven discoloration or the increase in the pigmentation of the skin. Hair loss is another one feature. You grow hair on the unwanted region and you lose hair from your scalp. Some women also experience sleep apnea. Apart from these symptoms, one may also experience stress, mood disorders, depression, anxiety, and eating disorders. The long-term medical condition associated with PCOS includes insulin resistance. They may also develop type 2 diabetes, high cholesterol levels, and high blood pressure and the heart disease. Don't fret. Having PCOS doesn't mean that you will have to face all these symptoms. Though PCOS definitely means that one needs to pay attention to their health and lifestyle, but keep in mind that it is not at all life-threatening situation, and you can easily continue and have a treatment with your dermatologist or your gynecologist. And the first step towards is that you should not ignore any of these symptoms. Look out if you have all the symptoms which I have listed there, and see to what order or what diseases you have in PCOS. Now, how to diagnose it? Like if diagnosing are again the common features or the symptoms which you are having in PCOS. Irregular periods, a blood test to identify the hormonal levels, whether they are high or low, and an ultrasound scan is a very important investigation in finding out the size of your ovaries and the number of cysts present in the ovaries. Now, what are the treatment? The treatment in this case is there is a multi-dimensional approach to the treatment. We may refer the patient to an endocrinologist, we may refer the patient to the gynecologist, and the skin symptoms like the increase in hair, loss of hair, and acne are treated by the dermatologist. As we have discussed earlier, that it is a lifestyle disorder. Changing your lifestyle from a sedentary to a more active lifestyle definitely helps in PCOS. Regular exercise, which means at least 20 minutes to 30 minutes 5 days a week is necessary in these patients. A balanced diet which consists of more of fruits, vegetables and less of processed foods and packed foods should be done in the case of PCOS patients. Now, the fresh fruits, vegetables and local produce like the grains and all kinds of complex carbohydrates, they should be consumed by the patient of PCOS, and their sugar levels must be checked on and off so that the patient does not develop any type 2 diabetes. Medication for irregular periods and infertility will be advised. Birth control pills can be given for irregular periods, and patients in which there is infertility, they can be referred to an IVF center, or they could be first treated with the hormonal pills to regularize their periods, and then the pregnancy can be considered. All the skin issues like the acne, hair loss and hair growth can be addressed by a dermatologist. She can also consult a gynecologist and consult even an endocrinologist for all these symptoms of PCOS. So don't ignore PCOS. Just look out for your symptoms of PCOS and consult a certified dermatologist or a gynecologist, and then find a one-stop solution for your PCOS. If you like our video, please subscribe it on YouTube. For more updates and information, like our page on Facebook. Thank you.